Good afternoon. This is Corey Portner, just looking to do a quick audio check with our panelists. Can you all hear me okay?
Yep, we can.
Yes.
Excellent. We'll begin in just a couple of moments. Good afternoon, everyone, and welcome to the Wednesday, October 21st COVID-19 Response Update Media Briefing. Today's panel includes John Weisman, Secretary of Health, Lacey Fehrenbach, Deputy Secretary of Health for the COVID-19 response, Dr. Kathy Lofi, State Health Officer, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Dr. Kira Massa, Co-Lead for the Behavioral Health Strike Team, Department of Health, Dr. Teresa Fotinos, Deputy Chief Medical Officer, Healthcare Authority, David Postman, Chief of Staff, Office of the Governor, and Reed Schuler, Senior Advisor to the Governor, Office of the Governor. Before we begin with remarks, I'd like to remind everyone that we will open with presentations from several of our panelists and then move into media Q&A for those media that submitted questions ahead of time. Given today's number of inquiries in the queue, if we're unable to get to everyone by the end of the briefing, we will follow up with you afterwards. With that, I would like to open with remarks from Secretary of Health, John Weisman.
Great, thank you, Corey. Good afternoon, everyone. Thanks for joining us on our weekly call. We really appreciate having you here. From a big picture point of view, this week we are seeing another rise in cases, as certainly are many states around the country. We've been concerned for some time that we might have more cases in the fall as we spend more time indoors, and so this is very concerning to us. Case counts in 15 of our 39 counties are climbing quickly near or beyond previous peaks. Dr. Kathy Lofi will go over some of those data in her presentation. So this places everyone, and especially our elders, our parents, grandparents, and those with diabetes, heart disease, cancer, asthma, and other chronic diseases at really great risk. When cases spike and get out of control, we risk overwhelming our hospital systems, which we again are seeing in some states in the country. But really the good news for us is it's not too late. By acting now, we can reverse this trend. We can squash the curve again. And now is the time for all of us really to recommit to those key behaviors that keep the virus from spreading. And that is wearing a mask around people who you don't live with, even those close family and friends who may be visiting or with whom we are in the car together. Remember, many transmissions occur before people even have symptoms of COVID, and that's really what makes these close visits so risky. Keeping gatherings small and outdoors whenever possible is the wise thing to do. This may mean bundling up outside while catching up with friends and loved ones. And avoid any indoor gatherings, but if you must, wear a mask and open windows and doors to improve ventilation. And of course, wash or sanitize your hands often and don't touch your face with unwashed hands. And then finally, stay home if you're sick or if you're exposed to COVID-19. So really the first main message of the day is that we've got this fall surge, and by acting now, we can squash it. And the second main message of the day is if you don't yet have your flu shot, now is the time to get it and get that off to your to-do list as soon as you can. Flu by itself is nothing really to mess around with. Since 2010, between 12,000 and 61,000 people have died from the flu each year, and 140,000 to 810,000 people are hospitalized each year for the flu. And of course, with COVID, having both flu and COVID spreading at the same time could put more people in the hospital and strain the healthcare system, and we really just can't allow that to happen. If we all get our flu shot, we can prevent that from happening. And we do recommend a yearly flu vaccination for everyone 6 months and older, including pregnant and nursing women, and people who are at high risk for flu-related complications. So as hopefully you can see from what I've said, flu really is a serious disease, and the flu vaccine is your family's best protection against the flu. Flu vaccines are now available at clinics and pharmacies statewide, and special guidelines are being followed to keep everyone safe from COVID, so you should feel comfortable going to get your flu shot. Flu does spread easily from person to person by coughing and sneezing. You can spread the flu to others one day before symptoms develop and again before you even know you're sick. So while the healthy habits we are using to prevent COVID-19 can also prevent the flu, which is great, the vaccine is still the best defense as well that we have against getting and spreading the flu. And you can learn more on the website by going to www.knockoutflu.org. That's knockoutflu.org. So get your flu shot, get it done, and we'll all have a better winter because of that. With that, I'm going to turn it back over to Corey.
Thank you, John. Next, we'll go to Dr. Kathy Lofi, State Health Officer.
Great, thanks, Corey, and good afternoon, everyone. I am going to share my screen with you all so I can show you some graphs. Corey, can you see this screen?
No,
we can't. Now we can.
There you go, Kathy.
All right. Great. Well, unfortunately, I don't have a lot of good news for you all. We are, really experiencing a fall surge here now in Washington, and I'm going to show you some data that supports that. First of all, I think everybody is well aware we are seeing a fall surge throughout the United States currently. Europe is also experiencing a fall surge. As John mentioned, we think this is partly due to the fact that the weather is changing. People are starting to do more things indoors, which can increase risk of transmission. In addition, there's data that suggests that this virus is going to be a seasonal virus, which means that it will likely spread more easily in the fall and winter months. So this next graph shows the number of confirmed cases here in Washington, and you can see that since the beginning of September, we've had a steady increase in cases here in Washington that is very concerning to us. At the same time, we have also had an increase in testing, and I think a question that I often get from you all astute reporters is, well, how do you know the difference between whether, increased cases are being driven by more testing? And that's a really good question because it can be difficult to sort out. So you can see that since the beginning of September, we've also had an increase in testing. We don't really collect a lot of data on people being tested, so we don't always know why people are being tested. Or whether more people are sick and that's driving the increase in testing, or there's some other change in the behavior of people in the population that is resulting in more people wanting to get tested. But there's two things that I want to show you that, suggest that, we are really truly seeing increased spread of COVID-19 here in Washington State. And the first one is the graph on the top, which shows the number of COVID-19 hospitalizations over time. And you can see since the beginning of September, we have what looks like we have been seeing a slow increase in hospitalizations. We have another data source that shows the total number of people with confirmed COVID in our hospitals on any given day. Around the middle of September, there were around 250 COVID patients in all of our hospitals across the state. And as of the last few days, we are now closer to having about 300 patients with confirmed COVID in our hospitals. So two different data sources are showing that hospitalizations are slowly increasing, which is concerning. Our death data, which is generally the slowest data source, still is bumping around a little bit. We're really not seeing a specific trend at this point in time. Next, I want to point out that our percent of positive tests, do appear to be slowly increasing, although not, dramatically. If you look at, again, the same time period from the beginning of September out to the current date, you can see that there has been a gradual increase, which was followed by what looks like maybe a little bit more of a plateau. But this is also kind of a concerning signal that we're moving in the wrong direction. If you dive a little deeper into our case count data, you can see that the cases are rapidly rising in Western Washington. The purple graphs on the top show data from Eastern Washington. The turquoise graphs on the bottom show data from Western Washington. And you can see that there's been a sharp increase in the number of cases reported per day in Western Washington. And in Western Washington, it also appears that the hospitalizations have been just slowly increasing as well. In Eastern Washington, these trends are bouncing around a little bit more. They appear to be kind of more flat overall. The last estimate for the effective reproductive number from our modelers were around 1, both in Eastern and Western Washington. But you can see that the vertical lines that are above and below these are reproductive number estimates are really quite long. And this means that while the best guess of our modelers is that the effective reproductive rate is around 1, the vertical lines show that the true reproductive number may be anywhere along that vertical line. So there's a broad there's a broad range of where the true value actually lies. I'm not going to go into this graph too much, but most of the growth in case counts in Western Washington are coming from our more populated counties. We're seeing increases in Snohomish, King, and Pierce County, Thurston County, and Clark County. Those are sort of the counties where we're seeing the biggest growth in activity right now. In Eastern Washington, our data are a little flatter, and we're finally seeing some downturns in Grant and Adams County, which are really great news. The one thing to keep in mind, though, is that the rates in these Eastern Washington counties are generally still higher than the rates in Western Washington. And our percent positivities in Eastern Washington are higher than those percent positivities in Western Washington as well. I think this is my last slide. Our modelers have also broken down the cases in Eastern and Western Washington by age group. And the bottom graph shows that this increase in cases in Western Washington is occurring in all the different age groups. So you can see the different colored lines, which represent different age groups, are all going up. Which is concerning for kind of widespread transmission in the population. So in conclusion, I think everyone on the call is aware by now that the United States and Europe are experiencing a fall surge. We unfortunately in Washington are now experiencing a fall surge as well. We're seeing rapidly rising case counts in Western Washington. Case counts are a little flatter in Eastern Washington, but the rates in Eastern Washington, the number of cases per population is generally higher in Eastern Washington compared to Western Washington. And we are seeing a slow increase in COVID-19 hospitalizations. The cases we're seeing are increasing in all age groups, which is concerning, particularly when we see increases in cases amongst the older population, because we know that they are at higher risk of having severe COVID illness. And unfortunately, still seeing transmission in a number of different settings. You've been hearing a lot about outbreaks on college campuses, but these cases that are occurring in colleges still sort of generally represent a small proportion of all the cases that we're seeing. So that's one component of the of transmission, but definitely not the full story. And with that, and then I think the last thing I was going to mention is that we are going to publish another report today, which shows our positive antigen tests. These tests continue to be a small portion of all of the positive lab results that we're receiving. And we are continuing to work towards incorporating those antigen reports into our dashboard. But in the meantime, we will continue to publish the data weekly in a separate report. And I think the bottom line is that they still represent a small portion of all of the tests that are being done across the state, but something we are keeping a really close eye on. And with that, Corey, I'll turn it back over to you.
Thank you, Dr. Lynn. Next, we'll go to Michelle Roberts.
Good afternoon, everybody. I'm Michelle Roberts, and in my role at the department, I oversee the department's vaccine planning and distribution work for our COVID vaccine when it's available. I want to start today by talking a little bit at a higher level around the work happening at the department and across the state before I speak more specifically about the vaccine plan that we shared this morning. Right now, within the department and across the country, public health is working with a ton of partners and stakeholders to really be ready to plan to distribute and prioritize a vaccine, which is really a life-saving prevention tool. This is hard work. So the plan, we had 30 days to get our initial draft done with about over 50 pages of guidance from the federal government. So this plan and the work to be ready to distribute a vaccine really takes research and collaboration and connection, both with our federal partners, with people here in our state, and right into our local communities. When we talk about a COVID-19 vaccine, we're really asking the question, how do we save people's lives? How can we reduce disease transmission in our communities? How can a vaccine be a piece of what's going to help us leave COVID behind us and kind of return to what's next? So we're really thinking through these things on behalf of all Washingtonians. That's our focus. Our team is laying the groundwork for distributing a vaccine once it's available, with the goal of hopefully saving lives and reducing disease transmission. We're not starting from scratch. We're relying on a strong infrastructure of vaccine distribution that's already in place. We have a huge team of vaccine experts within the Department of Health. Right now, we already distribute about 3 million doses of vaccines for children and adults every year in partnership with about 1,200 providers across the state. So we're starting from that. There's a lot more work to do for COVID, but we're building on the experience and existing infrastructure around vaccines to guide our work and build out these bigger plans. As far as the specific COVID vaccine plan, that was submitted to the federal government on Friday, per that requirement from them. And today we posted the vaccine distribution plan on the Department of Health's coronavirus vaccine webpage. I want to emphasize this is version 1 of the plan. As I said last week, the plan is more of a guidebook about the work we need to do to plan and to ensure we're ready, and less of a detailed having all the answers at this point. The plan's going to evolve over time as we get feedback from partners, the community, the further guidance that still needs to come from the federal government. The plan itself outlines the specific actions and steps the department will take, like developing equitable vaccine allocation, developing the strong infrastructure with healthcare providers for vaccine distribution and clinical training, how we're going to be tracking vaccine administration data, and how we really need to communicate and learn about the questions and concerns that public may have. So we're ready to answer that and provide information. We're also conducting focus groups and key interviews with communities that are disproportionately impacted by COVID. We're also talking with essential workers and the business sector. That work's happening through the month of October. Key groups include the African American and Black communities, Latinx communities, Pacific Islander communities, immigrant and refugee communities, older adults, people experiencing homelessness, farm workers, people with underlying health conditions, and individuals with disabilities. So in that group, you'll see a lot of the people who we know have been disproportionately impacted by COVID disease, or some of the places where we've seen outbreaks happening. We're also engaging with different communities and sectors who are at higher risk for getting or spreading COVID disease. So once again, including essential workers, healthcare providers, college students, early learning providers, and parents. We're gathering feedback from these interviews and focus groups and community conversations, and that's what's going to help inform our plans going forward, help us figure out what are the criteria and around equitable distribution. How can we help use that information to continue to figure out how we're sub-prioritize vaccines when there's not enough for everybody who wants to be vaccinated? We want to hear from you, from the community. Feedback on the plan is being accepted on the DOH coronavirus webpage. We also have a survey open, which people can take until October 26th. And like I said, these are just our first steps at feedback and engagement. This is going to be an ongoing process throughout our planning process, and then once even after we have a vaccine that is approved and ready to use. So while some planning still cannot be completed until we know what the final vaccine and candidates are, the bottom line is we're doing as much as we can to ensure as a state we are ready, as we understand how our residents are feeling about a COVID vaccine, what our partners need to be ready to vaccinate, so everything can go smoothly when vaccine is approved and the campaign starts. So that's it for my remarks today. Corey, I'll hand it back to you.
Thank you, Michelle. Next, we'll go to Dr. Kira Moffat.
Hi, everybody. Thanks for being here today. I'm here to talk a little bit about what's going on from a behavioral health perspective with regard to COVID. And I would just start out by mentioning that at 7 months into a pandemic as a natural disaster, it's very typical for people to be experiencing all kinds of ways, really, that we're affected by emotional, physical, sort of mental elements of the way that the disaster is influencing our lives right now. So getting that information out there to folks about what's normal right now and how common it is to be struggling in some of these ways is a really helpful thing. One of the things that's very common in terms of symptoms that folks are experiencing right now are some of the cognitive issues, not remembering details, not being able to track things very well, our thinking abilities, focus, a lot of the things that make us, sort of performance oriented and thinking about success and achievement moment are struggling, and they're compromised a little bit because of the neurological stress that we've been under for such a long period of time. So our bodies and our brains are not fully equipped to handle this much cortisol for this long of a period of time. And it manifests itself by coming out in all kinds of different ways. But the lack of focus and the lack of ability to really, sort of track things and pay attention to details in the way that we used to is one of the main ways that people are being affected. Other manifestations, a sense of exhaustion, not being able to fall asleep or stay asleep when you want to be, is a very common thing. Especially for those of us who are juggling like multiple roles with kids and work and whatnot, definitely common. And people tend to act in sort of one of two ways. So either by manifesting out, acting out, or by acting in. And acting out can look like increased substance use, aggression, sort of irritability, and anger. And that can happen within the walls of the home or outside in the community, right? And the other side is sort of this acting in phenomenon where people withdraw and they isolate and they become more hopeless and sort of down. And those are really common sort of human expressions for disaster response and recovery that people are drawn to based on personality characteristics and all kinds of other things, right? But those are common things as well. So something to keep in mind. Where we are situationally with the disaster of COVID and sort of the behavioral health concept of response and recovery is in what's called the disillusionment phase. And the disillusionment phase occurs typically for most disasters between about 6 to 9 months post-impact. So we're right in the middle of that at the end of October 2020, with impact phase for Washington State being approximately mid-March of this year. It's really common during the disillusionment phase for people to struggle with the sort of the coming to terms with what we lost and what we don't have. Heading into the holidays, heading into the darker hours of darkness and the weather changing, the disillusionment phase is bad timing for our state, for sure, because there's layers of things that are affecting people in a little bit more of a negative way than they otherwise might. So it's a challenging set of circumstances for sure, and we'd like to focus on sort of normalizing some of the behavioral health experiences that people are having, as well as promoting resources and promoting resilience and promoting active coping and growth mechanisms that people can use to really help themselves get through the next chunk of time, the next 2 to 5 months, in the healthiest way possible. So there's lots of things you can do to cope. Recognize when you might be exhibiting some red flag behaviors, or when other people in your family or friend groups or colleagues are doing things that are really out of character for them. Those are some things to pay attention to that might indicate a deeper problem going on. Don't hesitate to ask people how they're doing. Open-ended questions like, how are things going? Who, what, where, when, why, how? What's the status? What's been going on in your life lately? Just check in with each other. Those are sort of social, simple things that we can do to reach out and continue to stay connected. We have a lot of other resources through the state that are also available. The Washington Recovery Line is a great resource for folks who might be struggling with substance use. That number is 1-866-789-1511. And we have Washington Listens, which is a non-clinical support line. So you can contact them to get support around other resources that might be available, and just have somebody to talk to about what you're experiencing with regard to stress or anxiety. The Washington Listens line number is 833-681-0211. Other things that we can do, active development of resilience and sort of helping our brains reconnect. Take a little moment. If you find yourself really quickly responding, sort of impulsively reacting to something in an angry or aggressive way, take a moment, take a breath, and allow those parts of your brain to sort of communicate a little bit more effectively with each other. We all need to slow down just a little bit because the pressure of stress and the chemical results of stress on our brains really causes some of that emotional responding to things. It's really also important to stay connected as much as we can. Connection is another important element of resilience, and it's really hard right now. And connection can be anything, right? Connection can be to a higher power or to a family member or a friend, a loved one. Connection can be to a social cause or a nonprofit group. Anything that really keeps you from being isolated. Pets are another great way to increase connection. There are lots of pet adoptions happening right now, and that's a really healthy thing for folks. So lots of ingredients here in resilience. So purpose, sort of identifying what motivates you now, focusing on developing and maintaining connections with other people, as well as working on our general adaptability and flexibility. So humans have a hard time with change in general. We struggle with the unknown, and we struggle with things changing. And being adaptable and learning how to kind of roll with it is a challenge, certainly. But if we can work on that and we can actively practice it, we're going to be better off getting through this next 2 to 5 month period for sure. And the final element of resilience is hope. And that's a little bit less concrete. It's a little bit more individualized. But it really is about looking for opportunities in our daily lives to help support ourselves, help support each other, opportunities that might not have existed pre-COVID, but now are available for things that we can do. So hope is a great thing. And certainly collectively, the common response to any disaster is resilience. And collectively, we are stronger than this COVID thing too, and we'll get there. It might be a little bit of a road, but I have no doubt that resilience is, first of all, the most common outcome, and also what is likely to happen in this case too. So if we can actively work on the development of resilience amongst ourselves and work smarter, not harder, right? Work on doing things that take care of ourselves to get through this, it will help everybody get through these next couple months in a healthy way. So that's it for me, I think. Corey, can I turn it back over to you?
Sure thing. Thank you so much, Dr. Moffett. Next, we'll go to Lacey Fehrenbach, Deputy Secretary of Health, for the COVID-19 response.
Good afternoon, everyone. Thank you. After so many months of distancing and the stress from the pandemic, we are all, as human beings, craving connections with our loved ones and the sense of normalcy that some of our traditions provide us. As fall and winter approach, we are facing some particularly difficult challenges about how we'll spend time with our family and friends and share moments of connection around things like game days and holidays like Thanksgiving, as well as other traditions. To keep our loved ones and our community safe, and especially given the disease trends that you heard Dr. Lofi talk about, we'll need to redouble our efforts to have fewer, shorter, smaller, safer gatherings in Washington State. Gatherings in groups, even with people we know well, people we trust, people we love, can still spread COVID. The more people we interact with at a gathering and the longer that interaction lasts, the higher the risk is of becoming infected. So now is a great time to have the COVID chat with your family, friends, and loved ones. You can reduce the risk to yourself, to your family, and your friends through some pre-planning steps and conversations with very little trade-off. First, start with the conversation and get really clear with those you love about how you will make safety a priority when spending time together. You can set ground rules that will help everyone know what to expect. You should review your guest list. Are you inviting people who might be at high risk for severe disease or children? And if that's the case, what special needs or precautions will you have as part of your planning? You should also right-size your guest list. More people means more risk. Limit the number of guests based on the number allowed in your county. And as a reminder, under Safe Start, if your county is in phase 3, that's 10 people outside your household per week. And if you're in phase 2, that's 5 people outside your household per week. Check your space and gather outside if possible. Is there room to spread out? And is there room for 6 feet between people you don't live with? If not, you're going to have to move your gathering outdoors or to a park, for example. If you're going to meet outside, you need to consider things like restrooms. And if you're going to meet inside, you need to make sure your space is well ventilated by opening windows to allow outdoor air in. Remind guests to wear warm clothes, even if you're inside, because we're getting into the chilly winter months. On the day of your gathering, do a health check. Anyone who has symptoms, fever, cough, shortness of breath in the last 2 weeks should not attend. Guests need to check their temperature before arriving, and if they feel unwell or they know someone who has been exposed, they know someone who has COVID or have been exposed to COVID in the last 2 weeks, they also should stay home. Think about your kids. I have 2. Kids have a hard time staying 6 feet apart. So wearing masks and frequent hand washing will be really important and a part of your safe action plan. Remember that kids under 2 years of age should never wear a mask, nor should any child who's sleeping. Make a food plan. Talk through details about how food will be shared or not shared. If sharing, separate the food ahead of time into individual servings and forego communal bowls and utensils. Clean, clean, clean. If you're hosting, frequently disinfect surfaces, especially those that people touch often, like doorknobs and handles. Consider a pre-event quarantine. Can all participants, including yourself, self-quarantine 14 days before the gathering? Get tested. If you have been around many other people or do not regularly wear a mask, get a COVID test to make sure you're negative. Take into account that it can take a few days to receive your test result. If you test negative, you still need to wear a mask and keep your distance from others when you're socializing. The safest action, especially if you're high risk for severe COVID-19, is to avoid gatherings and find a different way to celebrate, like holding a virtual gathering. The state's website on safer gatherings has additional information to help all of us slow the spread of COVID-19 as we move into the next phase of the pandemic. That website is www.coronavirus.wa.gov/gatherings. With your help, we can have these important personal connection points while slowing the spread of COVID through fewer, shorter, smaller, safer gatherings. Thank you, Corey. Back to you.
Thank you, Lacey. All right. That takes us through presentations for today from our panelists. And with that, we'll move over to the Q&A portion. Just noting we have a large number of folks in the queue today to ask questions. So for those of you that emailed as the briefing started and throughout, if we're unable to get to your question by 3 o'clock, just know we'll follow up online by email and try and help you out there. So with that, we'll open up for first question from, go over here, Anna Boyko-Wayrock with KUOW.
Hi there. I read through the vaccine distribution plan and I hear you, it's the first draft. These are early days. It's a guidebook, not a playbook. But what is the thinking right now around cost to folks? If and when we have a vaccine, will providers be able to charge patients in Washington for that vaccine?
Great question, and that's an area we're waiting for a little more information from the federal government on and have several questions submitted to them. But here's what we know, that the federal government has paid for the actual vials of vaccine for COVID vaccine for now, and have said they have a commitment to making sure that every American who wants the vaccine will be able to get it at no cost. That doesn't, usually there is healthcare providers, even though they can't charge for the vial of vaccine, they could either charge what's called an administrative fee, which just kind of covers their time and materials for giving it, and potentially an office visit fee. That will be covered by health insurance. There's legislation had some language around to make sure that's covered for ACIP recommended vaccines. We still need more information on, is there going to be limits to how much those fees could be? And another piece is we're doing thinking on around is how do we make sure there's access and who's going to cover those types of related costs for anybody who doesn't have health insurance. So those are pieces we need to do some more planning around.
Great, thanks for that. And then another question, this is for everyone and especially for David. Now that it looks like the state is embarking on our fall surge, as you mentioned, going forward, what are you looking for in each risk metric that will show you that it's time to, again, delay elective procedures at hospitals?
John or Kathy, actually, do you want to start with that?
Sure, I'll start and Kathy can fill in. So one of the things is looking at the hospitalization data, as Kathy just said. We look at how many folks are in the hospital each day, what's the bed capacity, and what's the staffing capacity that folks have. And frankly, we are looking at that and hearing that it's getting tighter. right now. This is why also in terms of the flu, for example, we want people to get their flu shot. We want them to get it as quickly as they can so that we can keep people out of the hospital and taking up beds from being ill from something that we actually have a vaccine to prevent. So that's probably one of the main things that we're looking at there. Kathy, do you want to add to that?
Yeah, I think one thing I'll say is that we have much better data now than we did, back in March when we started seeing a surge of patients, and we're very concerned about our hospitals. Our hospitals report, every day into a data system that reports all the data that John just mentioned, the number of COVID patients, the number of beds, the number of ICU beds, the number of COVID patients on ventilators. So we really have detailed information. We also have an entity that sort of helps coordinate patient placement around the state as well. Our healthcare system partners can help place patients if there's a patient, with COVID or even a non-COVID patient, that needs to find a hospital bed. And that's another sort of area of visibility that we have into the system. And, obviously we need to have beds when COVID patients are sick. But, all this data can help us sort of determine when we might be sort of at that point where we're feeling like we don't, we're running out of, beds. And it's not really just beds and space. It's also staffing as well, because we need to have staff who can take care of patients. So that's just kind of gives you some, I think a general idea of kind of what we consider and what we're looking at, and, just feel like we're much better prepared kind of going into the fall than we were back in the spring.
All right. Next we go to Hannah Scott for Cairo Radio.
Hi, I'm first wondering, we heard from Snohomish County Health Officer yesterday about struggles with faith-based groups who were doing a lot of large gatherings, and that some outbreaks were being tied with that, and also a really growing lack of cooperation when it comes to contact tracing. I wonder if we're seeing anything like that on the state level.
Yeah, so I can start, and John and Lacey, you can join in. In terms of faith groups, we have had several outbreaks that have been associated with places of worship. It's in our outbreak report that we published once a week. I can't remember the exact number, but this virus doesn't really care where you are. If you're within close distance to somebody, you're not wearing a mask, particularly if you're in an indoor space that's small with poor ventilation, the virus is going to take advantage of that situation. So just like in, religious services, the virus is just as happy spreading there as it is in workplace settings and at social events. So we know that it's an important place where we need to be continuing to wear our masks, continuing to social distance, and now, heading into the fall, really thinking about ventilation too, inside some of these, in buildings where religious services are held. In terms of lack of cooperation, the state has some centralized interviewers that continue to do some contact tracing. We have presented our data previously and, have had some issues with people not wanting to cooperate. We do have a case investigation contact tracing report that we do post on our website every week. You can take a look at that. But yes, we do have issues with, we do not get 100% compliance with people calling our investigators back. And then we also have some people that we, eventually will connect with by phone, but then they say that they don't want to cooperate. So that has been sort of an ongoing issue that, we have noticed at the state level when our centralized contact tracers do this work.
I would just add, I think one of the things we're seeing is that people seem to let down their guard when they are with friends or people they know or family who don't live in the house. And I think that's perhaps also what's happening in churches. These are, these people as compared to going to a business or out and about where, you're with a whole bunch of people you don't know. I think in our heads, people are equating some of that as a greater risk. And what we're seeing is, that isn't the case. And again, because you can transmit this without any symptoms at all when you have it. So I think we have to help the public understand this isn't sort of just strangers. It's also the people we know and who we think of as friends and families.
The last thing I'll add, we do support follow-up on complaints that come into the governor's office related to Safe Start. And, DOH does this in partnership with local public health. There have been a number of complaints related to religious organizations. We really approach this from an education standpoint. And, as John and Kathy said, the virus doesn't care where you are, whether that's church, your home, a gathering out in a public space, you're at risk. And the more people you gather with, the longer you are with them and the closer you are with them, the higher your risk is. And so one of the common complaints that we've heard in particular in religious settings is around masks. And we really are calling on leaders in those faith communities to model wearing masks and encourage mask use among their congregations and their faith community.
Hannah, do you have a follow-up?
I did. Just a quick question for John or Kathy about an update on some of the longer term effects that we're seeing. Can either of you speak to that? I'm hearing more about neurological issues and respiratory issues that are long lasting, even after mild cases.
Yeah, this is Kathy. There's, there's been more and more publications about the long-term effects that have been coming out. And in fact, I think it was the United Kingdom that recently published a report on some of the longer-term effects. It does appear like the longer-term effects can affect multiple systems. Neurological effects, we're hearing about, some people who continue to have issues with, smells and other neurologic effects. There are concerns about cardiac effects. There's additional concern about some respiratory effects, some longer term respiratory effects in people, suffering sort of debilitating fatigue and some, ongoing shortness of breath. I think there's still a lot that we don't know. And I think first, we don't yet quite know the prevalence of this and how common this may be happening. Because we haven't even been able to sort of well define what's happening. And I think one thing that came out in the UK report is that it could be like a number of different sorts of syndromes that are happening together. But some people get hospitalized and are in the ICU and, suffer from, some ongoing challenges that other people suffer from when they've been in the ICU for a long time from other diseases. So that seems to be a subset of what's happening. But as you mentioned, there are some concerns about ongoing effects about people that have more mild illness. And I think there's still a lot we don't really understand about what is causing it and how to really best, continue to care for folks who, have these ongoing symptoms, which in some cases I've heard can be very debilitating. So lots more information to learn. And in fact, we were, we have ongoing webinars that we have with healthcare, clinicians. And I think in an upcoming one, I think one of our infectious disease docs is going to, kind of share some of the things that they're, seeing. So really active area of research and a lot we need to learn.
Next, we go to Ariel Dreyer with the Spokesman Review.
Great, thank you. My question is, looking at what some of the European countries are doing right now to sort of batten down the hatches, I'm wondering, is it possible for Washington State to look to lock down again like we did in April if things are sort of getting out of control? And, what levels of infection would necessitate such a move?
Yes, I'll start that. So John Weisman here. I think we're really hoping to avoid all of that. And if you look at what we did in the spring when we had this really new virus at the time that we weren't really prepared for, as Kathy was saying, in terms of having the necessary personal protective equipment or knowing exactly how infectious this was and when somebody was actually infectious. We had the sort of stay home, stay healthy order to help stop the spread, which at that point, was spreading to multiple people for each person infected, and also gave our systems time to prepare and respond. In the summer, we had this surge. And we were able to really bring that down while we kept many of our businesses open, essential services, and having people mask up. And we were able to bring those down. So I think it's our hope that we don't have to go back to that place. But really, that really depends in part on how well are we all going to do the things we've just talked about. Do our hospital systems become overwhelmed with too many patients? So we want to avoid that, and I think we can all help with that. And we were able to avoid that in the summer, so that gives me some hope. I mean, Washingtonians are hearing our messages, they are implementing them, they believe in science. And if we keep doing that, and if we redouble our efforts right now, we can, stop this rise that we're seeing now and bring our case counts back down. And the sooner we do that, the better we do that. And a lot of this, as I think we said, relates to, I think, people letting down their guard around family, friends, people we know, and not sort of realizing we have to implement the same measures in those groups.
Yeah, and this is Kathy. I think I'll add that I really truly believe that if everybody does their part, we can control this virus, we can keep our businesses open, and we can get our kids in school. And, those three things have been really our primary goals, at the state level. And I believe that we can do all three of these things if everybody does their part. But there's just, as John mentioned, we think there are just too many people who are letting down their guard, too many organizations and businesses that aren't, following all the guidance that's been put forth, by the state. And we're just really hoping that everybody can do their part and we can, avoid, needing to close any walk back any of the, business guidelines.
Next, we go to Keith Eldridge with Como.
Yeah, with the people that are going to be getting the vaccine, how can you ensure that it's going to be safe? Is there going to be an independent peer review, or is you're going to do like California's doing and join with them?
Yeah, great question. Well, first of all, I think we've shared before that we are going to be watching closely to see what the federal government will be doing, who really has the authority for licensure of drugs, vaccines, and medication in our country. And they've made a commitment to independent review in two different ways, by an FDA independent committee and then by the CDC Advisory Committee on Immunization Practices. So we're going to be watching both of those pieces closely and then decide what other additional pieces we may need here in Washington to really ensure that there's an independent review and that information about the safety of these vaccines and how well they work is available to all to help people choose if they want to be vaccinated. So that's kind of my piece, but John or anybody else, if you want to add anything.
I would just say we continue to have conversations with our colleagues in California and Oregon, and looking at how we do this jointly. So those conversations are ongoing. And David, I don't know if you wanted to add to that.
No, just what I was going to say, John. Thanks.
All right, next question comes from Evan Bush with Seattle Times.
Hi. The vaccine distribution plan says that Washington could get about 2% of initial doses. I'm wondering how you all arrived at that estimate and what makes up that estimate.
So that estimate is basically the percent of the Washington population compared to the U.S. population. And right now, from what we don't have final information from the federal government, but it does seem like they're talking about population-based allocations.
The next question comes from Ed Dawson with Kona Radio, and I'll be reading the question on behalf of Ed due to technical issues. Governor Inslee noted yesterday that businesses were doing a good job of enforcing the COVID masking and social distancing standards, and that the uptick in cases is coming from more personal gatherings like backyard barbecues, etc. If that's the case, couldn't more businesses be allowed to open up, or open up further across the state to help with the lagging economy and unemployment issues?
Corey, I'll try to answer that one first, and then I'm sure the DOH folks might have something to add. We're always looking at adjustments, but here's the important thing to remember. What the governor said was that it seems to be working in businesses. People are adhering to the masking orders and doing what they need to do. So it's not always the right impulse to then push that and to try to add stressors to it and get it to the point where maybe it doesn't work, because it's a lot harder to tamp back down those things. So any move like that has really got to be careful. And I think what the governor's point is, that's working, and we need other sectors, frankly, to get up to that same level of seriousness and following the guidance and the mandates. We'll be able to make much greater advances, which then will allow us to open up a lot more. We need to get over this hump. So it's not impossible. We're always looking at adjustments. We're always looking at ways to bring some equity to the calculation. But it's the case count that drives this most. And at this point, we're glad that it's working in those businesses, and we're going to stay there.
All right. The next question comes from Angelica Levito with Bloomberg.
Hello, thank you for taking my question. I wanted to ask how much you anticipate the state will spend on vaccine distribution.
Can I ask a question? Are you talking about like truly actually the distribution, like of the shipping or just the entire vaccine campaign?
The entire vaccine campaign, and if you can break out the actual distribution and then the education piece of it.
Yeah, we can follow up with some specific numbers because there is information available on our website about a funding request for the governor and the Office of Fiscal Management to consider. So we can point to you to where that's on our website that breaks it out. At a high level right now, we have gotten about $4.7 million from the federal government to support COVID vaccine planning. And that money came this fall and is good through June 30th. And we have some cost estimates, like I said, that are available on our website for all the different work that we feel will need to be ongoing after June 30th. And obviously, we're very interested into ongoing federal conversations to see if there'd be additional federal support for ongoing COVID vaccine work and COVID work in general.
Next, we have Alexis Krell with the News Tribune.
The vaccine distribution plan talks about these different phases. Once those phases are underway, what do you expect the timeline to look like? Do you have a sense of how long you think each phase will take?
Yeah, unfortunately, we don't have that timeline yet about what phases. The federal government so far has really just given us estimates about the first couple of months of vaccine. So those are the numbers that were mentioned earlier about what may be expected as far as vaccine supply. But I think it is pretty safe to say it could be 6 months to a year that we have limited vaccine supply. So much more to come, and that's one of the pieces of information we really still need from the federal government about what are the manufacturing estimates.
All right, we have time for 2 more questions. Next, we go to Natalie Swaby with King 5. Oh, looks like Natalie left it. So we'll jump to Ryan Blethyn, Seattle Times.
Yeah, hi. I was wondering, the new CDC guidelines on close contacts, how is that going to, or do you think it will impact case and contact investigations in Washington State, and how so?
Yeah, this is Kathy. I think you're referring to the fact that, CDC is now defining, CDC has defined close contact as being within 6 feet of another person for 15 minutes of time. And actually, we've been discussing within our public health system for a while, what does that 15 minutes mean? Does that mean 15 minutes of continuous exposure, or does that mean 15 minutes of cumulative exposure? My understanding is that the CDC has clarified that that really means 15 minutes of cumulative exposure, which is what we had sort of talked about as a state public health system as well. So I do think that a lot of our counties, were already sort of following, using, defining their contacts in that way. So I don't think that it will be, a great change to the way we have been identifying contacts here in Washington State.
The final question for today's briefing comes from Sally Ho with AP.
Hi, thanks for taking the question. I wanted to ask about the health department's child care guidelines, child care center guidelines, now that more kids are back in daycare. First, can you talk about the number of preschool age kids, 5 and under, getting tested and infected? And then more specifically, your guidance suggests kids with extremely common toddler symptoms like a runny nose or cough should stay home for 10 days or more. Do you think these new stricter guidelines around symptoms and also, mask wearing, sanitation, et cetera, will be here to stay even after the pandemic and daycares and beyond? And how will that affect access to childcare?
Yeah, I don't know. Lacey, are you still on the phone? Lacey seems, do you want to? I can help too.
So on the stricter guidelines, and if that will outlast the pandemic, I'm not sure we know. I think, there have been health and safety guidelines around symptoms and childcare and symptoms in school before COVID related to other infectious diseases. The social distancing measures around 6 feet and masks, the big question mark. I think the important thing is that we are closely monitoring how it's going through the pandemic, and we expect to be in this position of needing these interventions in both childcare and schools through this school year, if you will, basically at least until this time next year, and maybe even longer, depending on how the rollout of a vaccine and acceptance of vaccine goes, and when a suitable vaccine for children is available. So the really important goal that we are focused on is keeping the children in Washington and the staff that work in child care facilities, as well as the staff that work in schools, as safe as possible throughout the pandemic.
Yeah, I think the other thing I'll add is that we have been working with our healthcare providers in Washington to help, families decide like when it is safe to go back to childcare and when it is safe to go back to school, because we know that some of the symptoms that people can have with COVID-19 are really vague symptoms, like a headache, which could mean a number of different diagnoses, or, a runny nose on its own. And so we actually put together an algorithm that healthcare providers can use in the state that they can kind of work through to determine, when you need to test somebody, if they have certain symptoms, and, when it would be okay for that person, for that patient to go back to a school setting, a daycare setting, or a work setting.
The other thing I believe you asked about cases, the way the reporting works in Washington State, we get reports of outbreaks in different types of settings, and we publish a report on outbreaks every week. To date, and this is over the course of the whole pandemic, child cares were allowed to remain open even during the stay-at-home order in Washington State because they're an essential service. And healthcare providers and frontline responders needed access to childcare in order to go to work. So through the whole pandemic, there have been 79 outbreaks in childcares in Washington State. The good news is most of these outbreaks were relatively small and a few cases total. And remember, an outbreak is 2 or more cases with probable epidemiologic link.
All right. With that, that brings us to a little after the top of the hour and to the close of this week's COVID-19 update media briefing. I want to thank our panelists for making themselves available and for all of you for joining us, and a special thanks to tbw.org for hosting the live stream. This briefing can be found on tbw.org as well as others, and also check out the DOH YouTube account, which has past briefings as well. Thank you so much, and we will follow up with you next week.